残酷な天使のように少年よ神話になれ青い風が今胸のドアを叩いても私だけをただ見
Okay, enough of that. Gaucher's disease, or glucocerebrosidase deficiency, is when glucosylceramide, a type of lipid, basically gathers up in bone marrow, lungs, spleen, liver, and sometimes the brain. People with Gaucher's disease have a deficiency of glucocerebrosidase, an enzyme that helps the body process glucosylceramide. How is Gaucher's disease inherited? Well, basically, a person carries two sets of genes that tell the body to produce the enzyme glucocerebrosidase. Most of the time, two genes work perfectly fine, but if one of the genes is faulty, it's fine because one functional gene is all the body needs to produce enough of that enzyme. But when two people with faulty genes have a child, there's a risk of the child developing Gaucher's disease. There's a 24% of child developing Gaucher's disease, 50% of the child having a faulty gene, and 25% of the child not having Gaucher's disease or being a carrier. Symptoms include delayed puberty, frequent nosebleeds, enlarged liver, thin and fracturing bones, yellow spots in the eyes, easy brooding, slow clotting, mental retardation, convulsive muscle twitches, seizures, just to name a few. Some effects are easy bleeding, bruising, excessive fatigue, weak bones, bone and joint pain, and the enlargement of the stomach due to the increase in the volume of the spleen and liver. So how's it diagnosed? Well, scientists can find out if a person has it by testing the blood to determine if levels of glucocerebrosidase are too low. Or they could test you genetically and look for genetic mutations such as N370S, L444P, 84GG, and IVS2 positive. What's the prognosis of an individual with Gaucher's disease? Well, it depends on what type of Gaucher's disease you have. You could either have type 1 or type 2. Type 2 Gaucher's disease usually leads to early death. Most children diagnosed usually die before they reach 5. People with type 1 Gaucher's disease can live normal life expectancy with enzyme replacement therapy. Living with Gaucher's disease can be a life-altering event depending on the severity of the disease. Most people change their lifestyle to better cope with bone pain and fatigue. Socially, individuals who are concerned with body image may find consulting important. When it comes to your family, it may affect your children, and your family may be potential carriers of Gaucher's disease. What are the treatment options? Current treatment includes enzyme replacement therapy, or ERT for short, in which enzyme glucocerebrosidase is replaced with intravenous recombinant glucocerebrosidase, or imerglucerase. This treatment can help prevent the enlarging of liver or spleen, improve bone density and blood platelet count, though it does not treat nervous system damage. Next, we have substrate reduction therapy, or SRT, which aims at reducing the buildup and production of glucocerebrosidase. Miglostar is a medication for adults with mild type 1 Gaucher's disease. Last, we have bone marrow transplant, which replaces bone marrow damaged by Gaucher's disease with healthy bone marrow cells. Bone marrow transplant is only used in severe cases of Gaucher's disease, and there are some serious risks, including infection and rejection. That sounds like some kind of band. Since 1984, the National Gaucher's Foundation, or NGF, has helped to find treatments and cures for Gaucher's disease. So there are any great stories about Gaucher's disease. I have this one. At the age of 9, Ember was 50 pounds and was only 3'10". She wasn't growing along the growth curve, along with symptoms of vomiting, pain in her arms, legs, stomach, and bruising. It took 8 months until Amber's mother, Betty, looked up her symptoms and found Gaucher's disease. After a liver biopsy confirmed Amber has Gaucher's disease, she was referred to a doctor at the Children's Hospital of Philadelphia's Lysosome Disease Center. There, a team of doctors performed genetic tests to confirm Ember had type 1 Gaucher's disease. For the first 4 to 5 months, her family made the 3-hour trip to Philadelphia so Ember could be closely monitored. Recently, Ember has celebrated her 12th birthday and will be soon able to return to playing softball and tennis, things she had to give up during her diagnosis. Though she has to continue her infusions for the rest of her life, she can look forward to her normal life and leave her days of constant illness. The end. So since this is going on my YouTube channel, sorry for anybody that was expecting some other video that wasn't a science project, but I guess to pick it up, I have this blooper. I think you guys will enjoy it. Milsta or Zafokota Demajona. What, you guys want more? Alright, I have this random clip.
I'm coming up with 32.33, repeating of course, percentage of survival.
Wow.
Well, that's a lot better than we usually do.
Alright,
are we
chums
about
up.
ready, guys?
Let's do this. Leroy!